I'm going to talk about our results that we obtained from the study of the knee, bone and cartilage osteoarthritis through the feature analysis extracted from patient-specific image. Why study the knee cartilage degeneration? Nowadays, there are not a lot of treatments related to the to solve these problems on the cartilage degeneration. And the European Union invested in multiple projects to find a patient-specific solution to for the replacement or the repair of this kind of cartilage damage. And our final goal is to develop a patient-specific index and profile to complete this lack of diagnosis that there is in the study of the knee cartilage. And these will help to develop specific solution to different cartilage problems. As Paolo already introduced before a little bit, we were involved in the Restore project founded by the European Union in the frame of the Horizon 2020. This was our group involved, also with Aldo and Magnus here. And there were like countries involved, and also like Italy, as you can see there, there's no Sicily and Sardinia, but it's fine. Anyway, the Restore goal was to develop and validate the nano-enab solution for personalized knee cartilage regeneration, and our goal was to create the very first European database of knee cartilage models as a benchmark for this novel nano-enab solution to be as much personalized as possible. So this is the workflow of our work. We recruited 47 participants, subjects, and with the help of the clinicians, we divided them in degenerative cartilage. Most of them were like aging people, elderly people. We had 24 of them, traumatic, people with a traumatic damage on the knee cartilage from an accident, from a sports injury or something, and 8 control healthy subjects. We scanned them with MRI and CT scan, and we elaborated and we extracted a total of 96 features from a 2D analysis on the image itself and from a 3D elaboration from the 3D models of the cartilage. And we created a database that I will show in the next slide, which is public, is available online. And through the process of machine learning, we were trying using this feature to classify the cartilages, the degenerative, the traumatic, and the control subjects. As I mentioned, this is the database. This is a link for the database where you are able to download the STL file from all the cartilage, from the patellar cartilage, tibial cartilage, and femoral cartilage, and you are also able to see videos of and download videos of the 3D reconstruction. This is a video, okay. This is just a video shot about the database online. Of course, this is the main page with all the main features and explanation of all the main feature. After the registration, you can enter the database, select the patient by sex and gender, like age, the left and right knee, and the type of damage on the cartilage. And for each patient, you can go and see the 3D measurement and the 2D measurements. For example, in this one, you can see the X-ray with the ALBAC, which is a method to evaluate the cartilage status, and all the features with an image paired to the features. And for the 3D measurement, we can see some data related to the percentage of pixel and also the videos. This is clearly degenerative cartilage. This is very damaged, as you can see. You can download it. There is a page about the analytics, so all the statistics from the patients that we had, and the download page where you can download not only the STL file, but also the gray values extracted from the 3D analysis. So, as I already introduced, showing you the database, what are the features extracted? General patient data, of course, age, sex, cartilage status, 74 2D features manually extracted from the CT scan and the MRI images, and 22 features extracted with medical image software, Mimics, used for the 3D elaboration, like cartilage thickness, density, and volumes. And we, with the machine learning, apply two kinds of classification. We try to do the 3 classes classification on degenerative, traumatic, and control patients, but also we put together the traumatic and control, because as we were able to see from the cartilage image itself, there is a very big difference between the degenerative and the traumatic. So we try to do the binary classification. So the degenerative versus not degenerative. So as I say, binary classification. These are some of the images that you can see on the database. The 2D measurements, like for example sclerosis, bone attrition, osteonecrosis, osteophytes, cyst, and these were used for the binary classification, degenerative and non-degenerative. With of course, there were like more features than not the patients, so we had to do feature selection. We obtained a total of 13 features for this model, and we used logistic regression and support vector machine. With an accuracy, these are k-fold, with the k-fold to intense division equal to 5, equal to 10, and also daily 1 out, because of course with only 47 patients is not super easy to train, but with the k-fold equal to 10, we obtain very good accuracy, with also very good sensitivity on the degenerative patients, as well as with the support vector machine. And there's the feature importance. Osteophytes and lateral osteophytes, for example, is the most important with the logistic regression. These are some of the images you will see on Mimics. So from the CT scan, you're able to extract the bone mineral density, the cartilage density, the bone volume and surface. From the MRI, you're able to extract the volume of the cartilage, the surface of the cartilage, and the wall thickness and curvature. And with these features, and started for the 3D, we did the same kind of classification, binary classification. And we obtain good accuracy as well with the logistic regression, 85% with a 90 on sensitivity, and 88 accuracy with the support vector machine. And the cartilage volume, the femoral cartilage volume, was the most important feature. These are results that are actually under review right now, while these results were published on diagnostic, and we did here not the binary classification but the 3 classes classification with the 3D features, and we obtain a slightly less, of course, accuracy. We have 3 classes. We expected that, but 76.1 with the bone and cartilage features, and only with the bone features we were able to classify the 3 classes with a 76.1 accuracy. And as you can see from the tables here, the density of the patella, so the bone features have a high importance in the classification of the degenerative cartilage. The natural evolution of and the use of our database is going into this new European project we are involved in, called StimPain, a game changer for the treatment of osteoarthritis, a cost-effective combined advanced therapy to treat knee osteoarthritis. And this is a step forward for the patient-specific index and cartilage profile. So we were going to use all the data that we extracted from the 2D and the 3D analysis of these 47 patients. Maybe we will add more. And we are going to do feature selection. So this will allow us, using machine learning, to create this patient-specific cartilage, bone cartilage profile that will be validated. So we will create, finally our goal is to create this personalized solution for the cartilage. Thank you. I want to thank not only the people involved in the project, but they are here, but also Federica and Lorena that help us with the segmentation and the machine learning analysis. Thank you very much.